Hi, my name is Allison Young, and my health campaign is centered around eating disorders, in specific anorexia nervosa. First thing I wanted to do was give a brief background into what the illness is. So anorexia is an eating disorder that can affect many people. It's categorized by many things and can manifest in a few different ways, but some of the main things are things like obsessive food habits, usually under eating, and obsessive or excessive exercise. It can come with things like low self-esteem and a need to control your eating, restrict your eating, or purging. Who is at risk for anorexia? So it can obviously affect anybody, but the people at specific risks are usually women more than men. And this is because of society's attitudes towards women, basing a lot of women's worth off of how they look. And other things like social media is a really big problem right now with this illness. There's a lot of comparing that goes on. Photoshopping photos to make it look like you're smaller than you are can affect other people's mental health. And we have these big celebrities now doing it too, which is causing a problem for young girls looking up to them. Other things that might affect if you are affected with anorexia is if you have a family history of anorexia. If you have a family history of mental illness, things like anxiety can cause a need to control your eating, which can manifest as anorexia. Weight problems. If your family or yourself grew up or has had frequent weight problems, or maybe you were bullied or someone in your family was for your weight problems, that can cause disordered eating. According to John Hopkins, actually some people who participate in specific activities or sports are also more at risk. Things like modeling, ballet, bodybuilding. These are all things that kind of have an emphasis on the way you look in order to perform well in these activities. So those can put you more at risk for disordered eating. Okay, so these are the two people I interviewed. The first is a classmate and a friend. She is in recovery from eating disorder of 7 years, and she sought treatment initially through her primary care doctor. So I got to talk to her as well as a professional. I talked to the director of lived experience at Equipped Eating Disorder Treatment here in Carlsbad, California. The summary and what I learned, the key takeaways from both interviews were that anorexia is a really hard disorder to treat. It has a power over a patient's brain that causes it to kind of replace all rational thinking. This can make it really, really hard to treat. And the most beneficial thing for the treatment process is that the friends and family of the patient are fully involved and engaged. The patients often feel alone, and treatment can be a really painful time. So having friends and family be fully involved is the best thing possible for them. Another key takeaway that I took from both interviews are that sometimes doctors and the medical professionals that the patients go see can use toxic language around food or give advice to their patients having to do with diet and exercise that can actually be harmful to them and not beneficial. So I'm going to start with my first interviewee, my friend and classmate. I asked her what it was that she brought on her anorexia. And one of the main things she talked about was the environment she grew up in and how there's a toxic language around food in her household. And there was things like restrictions on sweets and junk food that she kind of made her have an unhealthy relationship with food. She was also compared to her sister a lot growing up by her parents, who is thinner than her. So that also had a big effect on her. I asked how this illness has affected her life, and she said the two most obvious things were her social life and the way she has a relationship with herself. Her social life was affected because she talked about how her friends always wanted to go out to eat and do fun things, and she had a hard time with that, and that was not something she was comfortable doing. So that really made her kind of isolate just into herself to avoid those situations. And of course, her relationship with herself, the anorexia in her brain kind of made it hard for her to trust herself, and that can affect how you view yourself and your self-esteem. Some frustrations she found when seeking medical help, and this is with recovery, with her anorexia, and just with other things in general, just basic things like ear infections, colds, things like that. A fear of being weighed. So going into the doctor's office knowing they're going to weigh you is something that was frustrating for her and also kept her away. Uh, Another thing was being told by doctors to diet and exercise as a fix for whatever health problems she went in for. That can lead her to feel unheard and like not being seen, kind of for what she's actually going in for. And it's also a really triggering thing to hear, and can cause some disordered eating problems. So yeah, there was a lack of patient-centered care. The relationship between provider and the patient is harmed when she's not being heard or seen in her issues, and also we're throwing around harmful advice that can cause disordered eating. My second interviewee, I talked about what is important when you're treating anorexia, and her big takeaway for me was that being authentic and listening were the main two things that you can do to help somebody. If you're your truest self with them, that's going to lead them to want to trust you, and trust is a huge thing in the recovery process. Something she talked about that stuck with me was how anorexia is an egocentric illness, meaning it is actually in line with the patient's values and the values of society. The values of society say women should be, or anyone should be, in a smaller body size to be better. So it's really hard to treat something that's in line with your values and say, no, let's go against this. She also talked about how it's anosognosic, excuse me for my pronunciation of that. And that means that the patients themselves don't actually see the illness as clearly as other people around them can, and don't see the severity of it. So it can also make that hard to treat because they're not seeing the problem. This can all lead for patients to not wish to get better or think there is anything for them to get better for, which can make it really hard to treat. Some other difficulties are that we live in a fat-phobic society, and our society pushes diet culture constantly without us even being conscious of it. Again, she talked about how doctors prescribe disordered eating to patients all the time. That was her exact words, which I thought was a cool way of putting it. Prescribing disordered eating to fix problems, actually causing more problems. Also talked about how uncomfortable and painful treatment is, and it generally does not feel good for the patient. I chose anorexia because of personal struggles. I think everybody in my generation has their own story to tell based on body image issues with social media and things like that. It's honestly become a joke within the generation. You know, if you see a picture of a really beautiful person you look up to and they happen to be thin, I see jokes on social media all the time where people will comment, "Guess I'm not eating today." It's horrible. So it's really normalized in our society, especially with this generation. So I think it's really important to talk about. And I also seen friends and loved ones struggle with it way too often. My health campaign. The goals of this health campaign is to spread awareness about the illness, how it can manifest, how it looks for yourself and your loved ones, so you can be aware of what to look out for, what things can be triggering and what things not to say or do around people with eating disorders, or just around anyone, because you never know what someone's going through. How to seek treatment and showing the beauty of life after recovery. Like mentioned in the interviews, recovery is not a good time usually for people. They don't want to seek it out. They don't wish to get better. So showing the beauty of life after recovery, I think, can be a really powerful thing. My health campaign is for doctors and medical professionals, young adults, and parents. Young adults, I think, are the most important people to help prevent this disease for, but I think doctors and medical professionals and parents are the people that are going to do the prevention of the disease. So that's why it's for all three. The budget and timeline. So I was looking at the spring semester and the fall semester that are coming up. And my budget would be $5,000 for things like renting out spaces and for traveling. So now let's go into what the actual campaign will be. I'm looking at doing talks and seminars and presentations around college campuses. Also, conferences where doctors and nurses are present, possibly part of training for those medical professionals to understand how the language can be harmful when you're talking to a patient with an eating disorder, or any patient. It doesn't have to be a patient with an eating disorder. Any patient should not be talked to with diet culture undertones, because ultimately that can then lead to disordered thinking and disordered eating. So for this health campaign, I really think it's important for it to be around college campuses, because of those young people that are breaking out into their independent lives and making their own choices around food and around, they have a newfound sense of freedom. So I think it's really important for them to be conscious of this decisions they're making and that their friends are making. If you surround yourself with people who talk badly of themselves and make comments about, oh, I shouldn't eat this, this is bad, uh, or there's a lot of talk that's so normalized that's really rooted in disordered eating. So I think it's good for college students to be aware of all of these things as they're growing into adulthood, so that they can have a better sense of how to treat themselves and the people around them when it comes to a healthy language around food. The doctors and nurse conferences or training perhaps around this, I thought was really important, because of how in both interviews my friend and the professional both spoke about how doctors can actually be harmful with the language they talk to patients about. And I personally experienced that. You go to the doctor, they always weigh you, and sometimes they have something to say about that weight, or they're asking you if you're working out enough, things like that. And that can kind of get into your mind and kind of make you feel bad about yourself. So I think that's really important, how gentle it is to go about talking about diet and exercise when you're a health professional, because your words really have weight to your patients. The predicted outcome of my campaign, like I just recently talked about, I just really wanted to spread awareness and make young people and doctors aware of how gentle this topic can be, and how we have so much in our subconscious about it already. Uh, I really wanted to benefit medical teams, how they communicate with each other and how they work with patients. And hopefully they become more conscious of the language they use around patients. I also want young people to know how to seek help, to recognize that they're struggling, and then know what to do about it. In conclusion, anorexia can affect anybody, although it does, for the majority of the time, affect women more than men. It can affect anybody, and it also doesn't have to just affect, the people that we see as anorexic. It can affect anyone, shape, age, size, gender, race, etc. Doctors can actually be harmful when prescribing diet advice. So that is something to look out for that I took away from this. Health campaigns strive to raise awareness and decrease the use of toxic language surrounding body and size. Thank you so much for listening. I hope you learned something about anorexia and about how my health campaign can benefit people of all ages and doctors and young people alike. Thank you.